Hello, everyone. Happy Wednesday. I'm Tammy Hughes. I'm a member of the communications team at Children's Wisconsin, and you have probably heard by now that this is one of the busiest starts to the viral season that we have ever seen. Families and health systems all over the country are experiencing this. It is the triple whammy of RSV, which is respiratory syncytial virus, COVID-19, and now influenza is kicking in, or the flu, of course. So the result has been longer than normal wait times when you want to see a doctor. And the last thing we want is for families with a sick kiddo to be sitting in a waiting room if they don't really need to be there. So we are going to be joined by two of our experts who have experienced all of this over the last few weeks and months. And they're going to give us some insight on these viruses and their symptoms and let us know, when do you need to see a doctor? When can your child stay home? Questions like, when is a fever a big deal? Do we need to test for RSV? And when do we need to seek care, like we said, or perhaps stay home? So our experts joining us today are Dr. Megan Lynch, Associate Medical Director of Urgent Care at Children's Wisconsin, and Dr. Kristen Bensick, a pediatrician at Bayshore Pediatrics. If you have any questions during our chat, put them in the comments. If we have time, we will get to them coming up at the end, so stay with us. Thank you first for joining us today, both of you. First, let's start with what you've been seeing in our clinics. Let's start with urgent care. Dr. Lynch.
Great. Thanks, Tammy. Thanks for having me. So I would say we're seeing our usual urgent care type of scenarios: injuries, broken bones, lacerations, stomach aches, stomach flu, rashes. But in addition, we're seeing, like you mentioned, a high number of respiratory illnesses. I hate to use this word, but it is unprecedented with the number of viruses, head colds, wheezing, asthma exacerbations that we're seeing. So very, very busy, which is bringing long wait times. And there are going to be some days that we may not always be able to provide care at that point in time for your little one, but we will get into that during the session.
Yeah, Dr. Bensick?
Yeah, and I mean, I agree. We are seeing the same thing right now between RSV and the flu, and COVID is still there too, which we don't hear as much about right now. It's been incredibly busy and our kids are really sick. And so this is why it's so important that we really are, starting to say, well, who really needs to come in and who can we treat at home and how can we help your family make that decision in the safest way possible, which also providing the best care for your children, which is always our number one goal here at Children's. And so that's what we're going to speak to today, about what we can do to help you guys make that decision and how we can continue to help take care of your children.
Very well said, Dr. Bensick. And let's start with one of those things that I have actually learned a lot about just in getting prepared for this live stream. Let's talk about a fever, because your child could have that whether they have RSV, COVID-19, the flu. When is a fever really a concern and the child needs to come in and see a doctor? When can they just stay home and, under the covers and take care at home?
Sure. I think, fever is probably the number one stressor for parents. It's an easy thing to get. It's an easy number to see. And it really causes so much concern for our parents. But the most important thing to remember about fevers is fever is a symptom. It's just telling you that your body is fighting an infection. The fever itself is not dangerous. There's no number that's a magic number that's going to hurt your child. And so what we really look at is, what's the fever, what's causing the fever, and how is your child dealing with that illness that is causing the fever?
Right. So that old wives' tale about, for some reason I had in my head 104 degrees is, that's when you need to go see someone. That's not necessarily true.
That absolutely is not true. And fevers, I think people hear about, is going to cause brain damage. That does not happen with a fever. Once again, we go back to, we're worried about the illness that is causing the fever and how is your child's body dealing with that illness. Now, I think part of the reason parents are so concerned about fevers is because for kids under 8 weeks of age, we're so concerned about fevers, and that's because their immune system's not fully developed. So when they have a fever, that's telling us there's a virus or a bacteria that's causing it. And with their lower immune system, they're more likely to have complications from that. So that's why a temperature of 100.4 rectally in a child under 8 weeks old actually has to be seen, most likely in the ear, because we're going to have to run a bunch of tests to say, where is that fever coming from? But for kids over 8 weeks of age who have normal immune systems, a fever is just a fever. And we treat it, with fluids, rest, Tylenol, Motrin, and really just watch how the child is acting with the fever, which is much more important.
And of course, we should point out, and the fever is a great example, there are some exceptions as far as if your child has some underlying medical conditions.
Absolutely. So if your child is on chemotherapy, if your child is on chronic steroids, if your child has lots of chronic conditions like chronic heart conditions, or that number one, if you have a baby under 8 weeks of old, that is different. And those kids we want to hear from right away, and we want to examine them, because once again, the fever is a symptom of something else, but because their immune systems are not up to par, they're not able to fight it as easily. And so those are the kids we really have to jump on quickly and see and figure out what the source of the fever is, so we can treat them appropriately.
Got it. That all makes sense. Dr. Lynch, let's talk about another thing that I'm sure parents are experiencing a lot of, which could be with any of these 3 viruses, and that's a cough. When is a cough something that they might need to come in and see a doctor?
Yes. Every morning I wake up to the sound of my entire family coughing at different pitches, and I think we all know someone right now, a loved one who is battling some sort of sniffles or coughing. So yes, coughing is a normal part of having a upper respiratory infection. Again, cough is a natural reflex, but there are some things that as a pediatrician get my attention when I hear about cough. So a cough typically can last 7 to 10 to 14 days. So if, families coming in and saying there's absolutely no relief of their cough for the past 2 weeks, that will get my attention. Often I can tease out that maybe the cough was getting a little bit better. They had a day or two where they were feeling better, and now this cough has worsened. So then that makes me think maybe they have a new respiratory virus on top of a previous respiratory virus. So duration, if it's really, 2-3 weeks of nonstop relentless coughing, that will get my attention. Coughing at night, again, in the setting of a lot of nasal congestion, can just be a sign that all that mucus is hitting the back of their throat, triggering that cough reflex. But a dry spasmodic cough at night can be a sign that those airways are irritated and inflamed, and that makes me start to think of maybe a little bit of asthma. Coughing with wheezing also gets my attention. Again, I think parents often come in and say, well, my child is wheezing. There will be times that you can audibly hear your child wheezing. Often, though, we hear wheezing when we use our stethoscope and we listen to their lungs. What I think parents often mistake wheezing for is just that kind of snot rattling around in their upper respiratory tract and their nasal passages. And then just the whole picture, cough with a child who's very lethargic, who has high fevers, who absolutely cannot drink. Those are the coughing kids that I want to evaluate, in clinic.
Right. And it might not sound great sometimes. That doesn't necessarily mean they need to come in if they've only been coughing for a few days. And another thing I wanted to point out, I was just going to say with RSV, I know that was really a concern with really little babies if they're congested and coughing and not able to, say, breastfeed or take a bottle or things like that.
Right. Like Dr. Benzik said, those babies in those first couple of weeks to first couple months of life are a special group. They're especially vulnerable for a simple head cold that the 2-3-year-old sibling comes home from preschool with. That's going to run its course. But for a 2-week-old, a 3-week-old, that simple respiratory virus can really make a huge impact on their everyday functions. That nasal congestion is going to make it very difficult for that new baby to breastfeed, to bottle feed. They typically breathe through their nose while they're drinking. So if they're a little plugged, it's going to be hard for them to stay hydrated. Again, their airways are small. They don't have a lot of force to clear that mucus. So again, we have to be especially protective of those new babies and trying to keep them as germ-free as possible.
Yes, new moms and dads and new babies, we have those doctors and nurses on speed dial for sure, for good reason. All right, another thing I know you all have experienced a lot lately, and I think COVID perhaps played a role in this because we were testing constantly for COVID. Is a child gets sick and a parent knows RSV is going around, they come into urgent care and want to get tested for RSV. But is that always important that we take all of these tests, Dr. Benson?
Sure. I think the number one thing I want parents to hear right now is we do not need to test for RSV. RSV is an illness we see every year. The babies, especially, will present in a certain way that we know it's bronchiolitis. And there really is no benefit to testing. It doesn't change our treatment. There's no medicine for RSV. And so we have a lot of parents asking for that test, and it really is not a necessary test right now. But if we move on to when parents should be tested, we're certainly seeing a huge rise in influenza right now. And we are also seeing COVID. Unfortunately, with the pandemic, I think we've had some fatigue with COVID testing, but it's important to remember those COVID tests are available at home. And if your child has fever, cough, congestion, sore throat, do a home test. We don't want to be sending kids with COVID back to school. We want to keep them home. Now, whether to bring your child in for influenza testing, we can certainly do a rapid test in the office, but if they've been sick for 4 or 5 days, all it does is tell us they have influenza. It doesn't really help us. It's good to have a conversation with the doctor's office about whether, even if your child we think has influenza, if we should test them or not, to decide if we want to do something like Tamiflu, which has a very limited window of when we can use it. And Tamiflu is an antiviral. And so that's a discussion to be had with a nurse triage at your doctor's office to say, hey, I think my kid has the flu. Do you think we should bring him in? What's the benefit of doing that versus just staying home and doing the fluids, rest, hydration, and keeping, giving them Tylenol or ibuprofen to keep them comfortable.
Right. And it would be a different scenario if the child has some underlying conditions we're concerned about with the flu. Whereas my 17-year-old daughter, who's otherwise healthy, if she has a fever and is coughing and I think she has the flu, I'm probably just going to, keep her comfortable at home.
Right. And I also think it's important to remember who's in your household. If you have a grandparent who's immunosuppressed and you think your child has flu, that would be a household where I would suggest testing for, just so we can help the surrounding family members. But I think, people think Tamiflu is a nothing drug. It does have some significant side effects. It does help decrease the severity of illness and shorten the illness course. But you have to weigh that with, is the side effects worth it? And is this an appropriate medication for my child? And that discussion really needs to be individual and with your physician's office.
Great advice. So testing, especially with RSV, maybe not always as important as some of these other illnesses. All right, Dr. Lynch. So for a parent who has a child that comes down with something, like I was just saying, perhaps my teenager, and I don't really think she's sick enough, she doesn't need to come in to see a doctor. How can I best care for my child at home?
Yeah. So, unfortunately, as I said, my family's like, we can put a man on the moon, but we can't treat the common cold. So, we have looked extensively at various medications, prescriptions, drugs, and how to treat all these symptoms of a common cold. The bad news is that we have yet to find one exact measure that stops the common cold symptoms. The good news is that most people get through the common cold just fine. So again, it really is about comfort care. So, first and foremost, it's just being patient with your toddler, with your preschooler, because I know for those young, parents out there, they wake up, they hear their child coughing. It's like patience, knowing that it can take 7, 10, 14 days for your kid to get through this. Comfort care in the form of controlling their fever. Again, I know Dr. Bensick said we don't have to be afraid of fever. Fever is part of the immune response to fighting off these germs. But let's face it, the reality is kids don't feel well when they have 102, 103, 104 fever. So, typically we say stick with one anti-fever medication like acetaminophen, or if your child is 6 months or older, ibuprofen, and go with that and dose it as needed. You don't have to do it around the clock. You don't have to do it every 6 hours if you're doing Motrin. You don't have to wake your child up to give them a fever-reducing medication. Sleep is part of the healing process. So just offering fever control. Again, can't emphasize this enough, but suctioning. Again, the nose, the nasal passages are part of the respiratory tract. So when they're plugged with mucus, that's going to make it hard for that child to breathe. that's going to make that difficult for the child to stay hydrated in the form of bottle feeding or breastfeeding. So nasal saline drops, the airways do better when they're moist. So that's why we like a little bit of that salt water, that saline. Either it's in the form of a spray or some drops to help clear some of those secretions. Again, on the market, lots of different ways to help clear your baby's nasal passages of secretions, whether it's the bulb suction that you may get at the hospital, the nasal Frida aspirator, which again, it's just a way to unplug those upper airways. Lots of fluids.
Yeah, I mean, why do kids have such an aversion to blowing their nose? I cannot. For years, my husband and I are like, get that stuff out of there, please. Stop just sniffling and swallowing. Ugh.
You know, the other day, my 10-year-old said she gets embarrassed to blow her nose at school. I was like, but do you want to hear, you want your classmates to hear you sniffling the entire time? So yeah, so just teaching your kids to blow their nose. Like you said, you know, having Kleenex readily available. I mean, I will say when my kids were little, I may or may have not used my sleeve to wipe their nose. That, I don't know, Dr. Bunsick, when do you think kids start to learn how to blow their nose? It's so variable. I have some like 10-year-olds who still don't know how to do it.
Yeah. And I say, and universally, they all hate things going up their nose too. So, but it's absolutely correct. We have to clear the secretions for these kids, and they don't understand. Well, yeah, if you're dripping down the back of your throat, you're going to cough. And so if you can blow it out, the better it is. And I give kids, we do some positive reinforcement, say, here's a sticker if you can blow your nose out. As soon as they're old enough to understand what stickers are, it's time to start using some positive reinforcement for that.
Yes.
My daughter, I swear by the neti pot. It helps me, and I make my daughter do it. She hates it, but she will admit afterwards that it usually helps. Yes,
I will say that the ears, nose, throat doctors and the allergists definitely recommend the neti pot. Some sort of saline rinse to your sinuses. I've tried that with my oldest. Didn't love it, but there is a ton of YouTube videos. I feel like there's a lot of like young Instagram kids who show how to do the neti pot, but again, that will just clear you of some of those heavy secretions, which again, I think is ultimately what's triggering a lot of that coughing itself.
Yes. Yeah. And an upset stomach. Sometimes they'll have an upset stomach, and it's from the drainage.
Yeah.
Yeah.
So, and we also said, lots of fluids. So whether it's breast milk, Pedialyte fluids, because again, when you're breathing a little bit faster with that fever, when you may not be drinking your normal, again, parents just have to be mindful of just trying to get those kids to take maybe smaller but more frequent feedings. Again, with whether it be a little cup, a syringe, the bottle, the sippy cup, just lots of fluids, sometimes warm fluids, soup, tea at room temperature. Again, this is all just about making your child feel more comfortable. Time on the couch, lots of cuddles, lots of TLC.
Yes, for sure. And we can't talk about, these illnesses without talking about the number one thing, which is trying to prevent them in the first place. And Dr. Bensick, what would you say are some of the best things that parents and kids can do this time of year to not get sick and also maybe just help themselves recover quicker?
Sure. The number one thing you can do to protect your child is to vaccinate them. Vaccinate them against influenza and vaccinate them against COVID. That is your best protection, is to prevent illness. And even though vaccines are not 100% in preventing illness, they prevent hospitalization and death, which is most important. Your kid might still get the flu, but if they had a flu shot, I can tell you they're going to have a lot lower fever, and they're probably not going to be sick as many days, and they're going to get back to their life a lot faster. The other things are just basic. Wash your hands, cover your mouth, stay home if you're sick. I know, everyone's sick of staying home because of COVID, but it's so important. If your child has influenza, they are incredibly contagious, and they will spread it to the whole classroom. Masking people have gotten away from, but we know masking works. Look what happened over the last 2 years. We didn't have influenza. We didn't have a big RSV surge. We know it helps. So if you know you're going to be in a situation, say you're watching your kids' Christmas play, you're in a big auditorium, put some masks on. It will help prevent the spread of illness and help you from getting sick. And I think especially with all our family gatherings coming, be really mindful of going out in large groups, and and be careful where you're at, because you don't want to bring it home to our elderly family members. We
Mhm.
don't want to bring it home to our newborn babies. If one of your family members has a baby and they're under 8 weeks old, don't bring sick kids into the same household. And so it's just really being mindful of how do we spread germs, and how can we help decrease the spread. But number one is vaccination.
Yes, great advice. Kids don't love that either, but it's important, and maybe they get, a sucker or a sticker afterwards, something like that.
Right.
Well, great advice, Dr. Lynch. Of course, there are definitely scenarios where kids will be most comfortable at home, but we also want to just remind families we don't want them to ever be afraid to call their doctor's office and ask questions.
Right. Right. So there's, different ways that if you have these concerns about your child, and you want the expert opinion of a healthcare provider. So again, like we mentioned, if you download the Children's Wisconsin app, there's this adorable symptom checker. You click on the symptom checker box, it brings up like a little figurine, and you can click, anything involving the nose or the head, and get a lot of the information that, truth be told, is the same type of information we're going to be telling you in person. But the benefit of using the app is you may not have been in a waiting room with kids with other germs that your little one may not have yet been exposed to. So Symptom Checker is a great resource. Dr. Benson can speak to just messaging the nurse triage system through Epic, or if you are at a pediatrician outside of Children's Wisconsin, getting some of that phone advice with the nurse triage is a nice step. And then, of course, like we talked about, if your child is at risk, or this illness is just not getting better, or you're really worried, then of course, bring them to urgent care. We are here. We have 6 different locations, walk-in appointments, reservations. We want to make sure that we are giving the right care to the right patients at the right time.
Mm-hmm. Yeah, and the only question we have, and I think this is a great question, to wrap this up, is, do we even know why this is happening, where all this illness has come from all of a sudden to have the worst viral season? Dr. Bensick, any thoughts on that?
Yeah, COVID. I mean, we didn't have illnesses. We were masking, we were staying home. Kids were not getting sick. We weren't getting sick. And so what happens is every year you're exposed to a lot of different viruses and you build up some innate immunity. We have not had that for 2.5 years. So now all of a sudden, kids are out, they are catching everything. And I know parents are coming to me and saying, "What's wrong with my child? They are sick every week since school started." And that's because we haven't been sick in 2.5 years. And so we know where it's coming from. And these viruses mutate and they get, a little bit more aggressive. And so I think we're seeing that a little bit with RSV too, which we traditionally have seen every single year since forever. But these kids are getting sicker because they didn't have the exposure to it the year before. And it's a really interesting thing we're seeing right now, but this is because of what we've done in the past 2.5 years. And this just goes back to the fact that we know how we can help keep illnesses under control. So going back to washing your hands, covering your mouth, staying home if sick, we really need to go back to the basics of how to control just infection control. And think about the public health aspect too. This is so important, that you want to stop spreading things. So maybe it's not COVID, maybe it's influenza, but influenza kills lots and lots of people every single year. And so it's really important that we think about how we can protect not only ourselves and our loved ones, but also the people around us.
Yeah, I've talked to some friends and family members. We have, the at-home COVID tests that we got from our health department, and one of us will get sick, we'll take a test, and thankfully we're usually negative, but I'll still mask if I go to the grocery store, or, just to be mindful if I'm not feeling well, because why not? I don't want to spread it, and, I certainly don't want to get it either, if depending on what it is that I have. It's just, I've just started to be more mindful of that during this time of year, that we can always mask.
Thank you for that. Yeah, spread the joy, not the germs. But again, just hand washing. The other thing that drives me crazy is I see people cough, and they cough in their hand, or they just cough. You got to cough into your elbow. That cough hygiene is also really important. So you never know, even if it's COVID negative and you have a big sneeze, but you may have the flu and you didn't do a home test for the flu. Now this other family who's going to be heading out to their Christmas vacation is going to be hit with influenza A. So there's always this trickle-down effect that I think we all need to be mindful of.
Yes. Well, thank you both so much. I just want to, we talked about the symptom checker. It really does. It's on our Children's Wisconsin app. So if you go to your Apple App Store or Google Play, you can download our Children's Wisconsin app, and the symptom checker is there. It really takes you through step by step and helps answer a lot of these questions for you. What your symptoms are. It has a picture of a child's body, and you point to, what's hurting and what's causing issues and what it might be. So it's really helpful, and we highly recommend that. And as always, Children's Wisconsin is here for you. You might be experiencing longer than normal wait times because it is, like we said, a really one of the earliest and most intense starts to a viral season we have seen in a long time. But we are here for you, Dr. Lynch, Dr. Bensick. Thanks so much for joining us today. And thanks to everyone else for joining us. Stay healthy.
Thank you.